Good morning, everybody. It's a beautiful day. It's really pretty out here. It's a little cold, but it's supposed to warm up. It's a good day for playing football. Not for me, but for lots of other people. So Judith Tackett is our guest today. Judith, good morning. How are you?
Good morning. I'm good. Yeah, it's
Good.
nice. So I'm awake.
Well, good. All right. So we usually start for just a minute, just kind of talking, and then we'll start in just a couple of minutes whenever we let everybody on. So you're sitting outside on a porch. Looks very comfortable. I'm seeing pictures behind you. It looks like there's a picture of some coffee mugs behind you to your left. Is that right?
Yes, that's my morning inspiration.
I wondered if that's it. Just reminds you to get some coffee. That's really, really good. So have you been doing anything exciting over the last couple of weeks? Anything that you want to tell me, or maybe not?
The most exciting part in my life right now is a puppy. And I think some of the people on here, because it's funny, I bring him up. It's Winston. He's my Facebook story that I have going. And a lot of people on here keep mentioning him. So that's the most exciting part.
Well, that is exciting. Very good. Let's see. Anything? Well, we'll get into all the stuff that's exciting at work. Have you been watching any football? Do you watch football at all?
Not so much. I'm following a little, but I haven't been actively watching this year so far.
Yeah. Well, it's been kind of such an interesting year. So I've been watching. I watched some of the baseball playoffs. I'm a big Cincinnati Reds fan, and they quickly lost, so they're already out. But I watched some of the games last night, and I think I'll watch some of the college football games today. And obviously, the Titans have had to not play this weekend, but they'll get back up to speed. Interesting week. Lots of things obviously happening.
Since we're at sports, I would have missed not to mention the Predators and Roman Josi, fellow Swiss citizen, and the trophy he got. So we are very proud, the whole country.
I understand, and we're going to mention that in just a minute. Because people are interested about where you're originally from. So let's get started, and then I'll ask you that, because it's about 10:03. So we have as our guest today Judith Tackett, who is the director of the Homeless Impact Division out of the Department of Metro Social Services. So Judith, we really are glad that you're here. Thank you for taking the time this morning.
Well, thank you for having me.
And a couple things as we start. I know we have Councilmember Tom Druffel is on the call, and we'll probably have some other people jump on at some point. We just saw the latest numbers on COVID in Nashville. Increase of 22 cases from yesterday to today. So very low. That's very good. 22 cases. So our numbers are down. That's a good thing. I hate that we had 22 cases, but the fact that the numbers are down is very good. Obviously, this is October the 3rd, so we are in phase 3. I know there's some different limitations still on, but that's a good sign. And overall, I think we had 29,158 total cases. And that's my dog deciding to bark in the middle of this. She'll stop in just a minute after she goes to chase whatever it is. Overall, 279 deaths, an increase of 1 from yesterday. So let me see if I have anything else to report in this morning. I will tell you that I just came from a volunteer program called One Gen, which serves food on Saturday mornings. It was in different locations. Today, it was out by the old Greer Stadium, and they had a lot of volunteers. Vanderbilt was involved. A number of other groups was involved. This is something they do every Saturday morning, and they provide food for about 500 people. The cars were lined up. I got there at 7:30, and I think the cars had already been lining up. So anyway, very, very good program. And eventually my dog will eventually give up because she can't get to wherever she's trying to go. So Judith, welcome. For people who don't know you, why don't you tell us a little bit about yourself?
Okay, so if you probably hear my accent, and as I get tired, you hear it more. I'm from Switzerland, originally the German part of Switzerland. I came and moved to the United States and to Nashville in 1995 to go and study journalism and political science at Belmont University. During that time, some friends of mine, a police officer, engaged a person experiencing homelessness and engaged some of us to help him off the streets. So that's kind of where it all started for me. I believe everybody who's passionate about ending homelessness has a story like that. So I wanted to quickly share mine. His name was Ernest. We kind of master leased an apartment for him, did some fundraisers. He passed away a year later. He was terminally ill, severe mental health issues, a lot of issues that we had absolutely no experience. The interesting part of that is that's how I got to meet my husband. Helping a person experiencing homelessness off the streets and into an apartment and providing support services, dignity, and community for him. And that's how I met my husband, and we got married later, and that's how I remained in Nashville. So that's summing up my story.
So tell me, where are you from in Switzerland?
It's a very small village called Hinau. It's in the canton of St. Gallen, northeast of the country, near the German and Austrian border.
And again, tell me how long have you been in Nashville?
Since 95, so that would be 25 years.
Okay. And how long have you been with the homelessness division?
So that's another story, because I was a journalist first. Back then, when I started, it was the city paper. Some of you may remember the city paper. I went to freelance, and around that time, when I was still at the paper, the Metro government created the Metropolitan Homelessness Commission, and I started covering the commission and also social issues. And when I freelanced, got hired to do some freelance newsletters and things like that. So one way or another, I have always been connected to the Homelessness Commission since it started. We moved from, back then it started at Metro Social Services, moved to MDHA, the Metropolitan Housing and Development Agency. And at that point, I got hired as a contractor. We moved back to MSS, and that's when I got hired full-time as a communications coordinator, and ended up as the director. Okay.
So tell me, so just for everybody's benefit, tell me what do you do at the Metro, at the Homeless Impact Division for Metro government?
So we're mostly doing planning and coordination. What that means is we are our community's homeless management information system lead agency. Homeless management information system, some people will know it as HMIS, is a database that is community-wide. It's managed for the community to assist and look at how people flow through our system. Where do they get services? How quickly do they move from homelessness to housing? It really helps coordinate efforts, cut down in duplication of services, and also provides a fuller picture of homelessness in Nashville. We actually only this year got it to a state where HMAS will become a functional database for our community. I'm very proud of my team to get that achievement done. I'm very proud of the community to get that done. It's a very important tool for coordinated effort and serving people more efficiently and quicker.
Okay, so you get this data, you're working on getting all this information together. What kind of, once you get the data and once you pull all this stuff together, what are the long range, short-term and long-range objectives of the division? What are you actually trying to do with the information, and what kind of services can be provided?
Yes, we're using it for planning. We are starting to send the data back out to the community. There's a monthly report. Anybody on here that's interested in that, please email me, judith.tackett@nashville.com. I'm gonna include it in a newsletter so you can actually get that detail, you know, those data points. We also, it's about, we're using the database to develop a coordinated entry process and a coordinated entry model. We have one in place. We're improving it right now to focus on helping the most vulnerable people off the streets and out of shelters first, because there's limited resources in Nashville for everybody who's working on this issue. So the data, what we know will help us identify. There are community assessments that are captured in that database that identify what do we know about a person, how vulnerable is that person. Our team is also holding a weekly care coordination meetings with stakeholders, with partner organizations, to not just look at the data, but also hear from the service providers about a person, and they can advocate if somebody is actually more vulnerable in reality than an assessment would identify them, or based on their responses. So it's really a tool that, in addition to a lot of meetings and coordinations with service providers, so we're managing a whole lot of meetings as our team. I have a 10-member staff. We have 2 outreach workers for entire Davidson County. That's where actually right now, one is working and assisting at the fairgrounds usually. So I have one to respond to any when we get complaints or concerns about people on the streets, we respond to that as well.
Okay, so there's a number of groups out there, number of providers, service providers that do a great amount of work dealing with the homeless. So you've got everything from Open Table Nashville to the Mission to Room in the Inn. Everybody has different pieces of that. So explain to people how all this kind of works together. You're pulling in data, you've got outreach workers, Open Table has outreach workers. How does all this come together for the purpose of trying to provide services to the homeless?
Yes, and this is actually a good time. I'm going to be as concrete as I can.
Mm-hmm.
So through COVID, our community prior to COVID gets certain federal dollars. I'm focusing on one federal source that's called Emergency Solutions Grant. It's usually, this year's regular allocation was $450,000, which is not much when you think about it. Nonprofits have to apply for it. These federal dollars are actually managed locally by MDHA, the Metropolitan Housing and Development Agency. And nonprofits apply for these dollars, so it's smaller grants that they're getting. Now, through COVID, the allocation this year has been increased for one-time funding of $10 million. So when you think about that, that's a more than 2,000% increase. So with that, we have received technical assistance from the federal government, a consultant to help us with the conversations as the community. So these conversations have been happening, but without dollars behind it. So now that there are dollars behind it, the conversations are speeding up and we actually can work together. So concrete, what that means. We have looked at, here are the dollars. These funds can be used for prevention, street outreach. They can be used for shelters. They can be used for rapid rehousing, and then also for the database if you need the HMAS entries, if somebody needs to pay for that and have us hire for that. So we had multiple over the summer, as soon as we knew these dollars were coming in, multiple stakeholder meetings with the nonprofits to come up with a plan that's coordinated. Rather than say, go apply for it, how can we actually create collaborations to identify people that are extremely vulnerable, identify people on the streets, and work with the shelters to get them into housing as quickly as possible. The community in those meetings, and we have about 30 people participate in those meetings. I would guess it's more than a dozen organizations that are involved in these meetings that have the capacity to house people and to hire case managers for the rental support and support services or do outreach services. These groups have decided their focus for these dollars is mainly, not exclusively, but the main is a portion on outreach, street outreach, to identify people and get them in the database, get the paperwork ready, help them with the transition. And then a large portion is going to be used to pay rent assistance for up to a year and case management and support services for up to a year as well. And we are now also entering the phase of, now we're bringing organizations together that have people that look for housing on behalf of their clients. So we're coordinating with that group, which is about 15 people right there, 15, 12 organizations. And we are looking at, if you're working with a landlord, we're not going to mess you up. So we're going to contact the ones who is not working with some landlords on an ongoing basis, who need some help. How can we identify the housing? So when these emergency solution grant dollars are actually being paid out and agencies build their programs, we have actually housing opportunities ready for people. This year, I saw one question had come in also about, so where do you find the housing opportunities? And that's where it's so important to work together, to really look at every opportunity. Now, this year with COVID, a lot of the motels struggle, as we all know, and these dollars allow, if a motel owner is interested for long-term lease, sign a lease, they need to have a 1-year lease and negotiate with a nonprofit on what the rent is and the support services. So 1-year lease plus an option after the lease to renew. That will be fine to serve as permanent housing, but it really needs to be the option to renew with that. So those are the coordination efforts and the conversations that are going on. I am so impressed with the nonprofits, how they have come together, and the applications. It's, for example, 2 or 3 nonprofits would have one application decide who's applying, and then they're working together on the ground. So it's not it really cut down in the competitiveness nature of applying for grants, and really looking, if we want to serve people, if we want to serve, and the goal is to house 400 plus people that otherwise would not be housed, then what do we really need to do to put that person and the people at the center? And that's kind of the coordination effort. When I say planning coordination, that's going in here.
Okay, so that's so the $10 million is federal funds.
Yes.
That you all have now available for this year. It's not recurring, it's just the one time.
No.
And is the goal, I think I wrote down that the goal is to house 400 people, is that right?
Yes, 400
okay.
plus, it's like, that's what we hope for, yes.
Okay, and have we, when did this start, and have we had any success so far?
So the application has been closed about 2 weeks ago, and should be the announcements of who's receiving what type of grants should be over the next week, I expect. We think the dollars and the programs will actually start towards the end of the month, early November, just to give nonprofits need to hire the staff to build these programs. And that's actually when the programs will start. So that's where we are pushing for housing locating housing opportunities right now. Yeah.
So go back. So did organizations apply for the grants, and then they're going to take the money and then utilize it to try to house people? Is that how it works?
Yes, that's
okay. All right. So groups could apply for the money. How much money was involved in for that particular part of the program? Do you know how much money was overall?
For the rapid rehousing, okay, you can't hold me to it, but it's about 6 million will be set aside,
Okay.
around 6 million somewhere, for the rapid rehousing. I think there will be about 800,000 for increased outreach efforts, and that is a key because we all know that's where homelessness is visible, streets and encampments.
Right. Okay. So tell me, so let's morph that into, obviously you've got a lot more money to play with this year. And my guess is it's because of the pandemic.
Yes.
That's where this money is coming from. So tell me what's going on right now in terms of, we know that the pandemic doesn't care, COVID-19 doesn't care who it attacks. I mean, obviously from this week, we know that.
Yes.
So you've got homeless individuals that also are getting sick. So how is all that playing out right now? If people have, well, let's just take the whole thing. If they've got, let's take COVID and any other serious medical issues, what happens? How do we get those individuals who are sick into places where they can get well?
Yes. So very early on in the pandemic, the conversation started, and the shelter at the fairgrounds opened in April. And that was set up to relieve local shelters, so to make sure that social distancing was doable. And mainly, when I say local shelters, in our city, that's really Nashville Rescue Mission. They have a men's and a women's campus, a guest house. And just to make sure that the social distancing was able to be maintained, Metro opened the fairgrounds and initially just took groups of men, groups of women to relieve the efforts at the shelter. That's when also the partners, Metro Social Services, quickly reached out to partner agencies. Mental Health Cooperative, Neighborhood Health are the lead partners in providing telehealth or health support just to what's happening there. A second building at the fairgrounds was opened for isolation based on CDC guidelines under the leadership of the Metro Health Department. It's a congregate shelter, but it's set up in a way that's safe for a section that is totally separated for people that can isolate when they are COVID positive. And then another section for people that are waiting for test results, just to also allow them to isolate and not, and have a place. And these sections are actually staffed by health providers. Hospitals, when they have a person that identifies as, that is experiencing homelessness, but is not sick enough to need to stay in the hospital, they also can refer and will refer to the fairgrounds so people can recover there and have the supports. Metro Social Services immediately focuses on the housing effort and what can be done. Once people from the isolation shelter are cleared, they can choose to move over to the well side, the social distancing shelter. And then in encampments, Neighborhood Health has been working with the health department. Neighborhood Health is taking the lead and to do some testing in encampments. So far, I just checked actually this week. So far, there has been one person coming back as COVID positive out of an encampment, and also was coordinated to to isolate at the fairgrounds shelter. And those are the things and the efforts that are going on. Nonprofits have also, there are several nonprofits, especially around the veterans population, that have motel vouchers available that are funded through the federal government for specifically veterans. I have been working since May with a small nonprofit in town on a pilot project that we partner with the Frist Foundation, got input from the Bloomberg Associates, just to see what we call it a mobile navigation center, what that can do to really focus on people off the streets and in encampments who will not go for whatever reason or cannot go to a shelter and are super vulnerable to COVID. It's a very small program, but I think it offers a sustainable model even after the pandemic to fill gaps potentially long term.
Okay.
Yeah.
So, so there's some good questions coming in. Well, the first question was how many people, first of all, are out at the fairgrounds right now? The second part would be what is the capacity? And then the third question, which I think is very relevant, is there are people obviously coming in through the fairgrounds at this point. I mean, as much as this pandemic is so horrible, it did open up space at the fairgrounds, and we do have a place where people can go and get get some treatment and be safe. So the question is, while they're at the fairgrounds, so there's three questions coming. How many people are there now? What's the capacity? And while they're there and before they leave or when they leave, what kind of services do they get? And are there possibilities to get people into services and maybe into housing? Because as they're coming through the system, they're right there in front of us.
Yes. So I'm taking some notes here, and I am looking up as of yesterday at the fairgrounds. Well, one of the things I need to, meanwhile, in June, actually, Metro opened a second location for women at the municipal auditorium.
Mm-hmm.
So at the fairgrounds, let's start with the capacity real quickly.
Okay.
The men's side at the fairground, where the Bell Shelter, COVID negative, is 200 to 250 is the capacity. And that's for social distancing, that's really set up in a way that's 6 foot distance and people can avoid each other in that and have their space.
Do we know how many people are there right now?
Yes, as of yesterday on that side was 63. 63,
okay.
Yeah.
Okay.
And then I am not the PUI with people under investigation. We don't really like the term, but it's a health term that we're using. It's really people awaiting testing or people who have some symptoms. It may be a fever. That right now, there are 73 right now, and then there are 2 COVID positive on that, on another, on the COVID side. Right now, and also you may wonder why there are so many right now. There was a person identified this week at National Rescue Mission who tested positive in their chapel, and out of just precaution, people are given and provided the test and just given the opportunity to isolate at the fairgrounds.
Okay,
And then,
so I know I keep interrupting you, but these questions are going to keep coming. Sorry. So so tell folks. So somebody tested positive who was at the mission. Did everybody who was in contact with them then go to the fairgrounds because they cleaned them out of the mission or cleared them out of the mission to go someplace so they could get properly tested and determined? So that's how they ended up at the fairgrounds?
Yes, exactly. And the health department, when somebody tests positive like that, the health department is immediately involved and the contact tracing starts. And that's then where people are moved to the fairgrounds and they receive a test until the test results come in. That's where they stay and can stay. Yeah.
Okay. So tell us now, okay, so now I guess go to the municipal auditorium where there's a women's shelter.
Yes, and that capacity is up to 200 women. And as of yesterday, there were 22. And that one is only for people that are negative. I mean, it's if a woman is under waiting for a test or COVID positive, they're also going to the fairgrounds. That's all. That one is set up individualized. I mean, it is all in one building, but everybody has their section. So that is just handled all in one building with the more intense healthcare and precautions for COVID.
Okay, so next question is children and And then eventually people will want to know about pets. How does all that work together?
Yes.
Where do children go?
Yes. Children is single women with children are at the mission.
Okay.
And then when there are situations, which we've had, where there's a family, and usually what happens there is somebody in a hospital, a family member is identified in a hospital with children. They identified not having a place to go. And then what we do, if our office is pulled in by the health department or hospital, we start coordinating. We're calling nonprofits, Safe Haven Family Shelter, the Salvation Army, Nashville Rescue Mission, and we have coordination calls to really see where can people go. Is there somewhere where somebody has a motel available? What is the situation? Usually there is a family member somewhere where we can help set up in a safe way, where the test, I mean, it's a whole individualized coordination effort. Yeah, and
So,
we have it about a few times, but it's not as much as, thank God,
right.
children very well.
So how does this, is it coordinated through your office? So I guess the question is, particularly in a situation where there's a lot of different things all happening at the same time. If you've got a family situation,
yeah,
and I mean, this could bring, because of COVID, it has different ramifications. You could have the mother get sick. So then you've got children you've got to deal with. Are you doing it on kind of an individual situation, and is it kind of coordinated through your office to figure out where is the right place for everybody to go?
We are not the designated coordinator. We are brought in when there is a situation that is not easy to solve.
Okay.
So usually all the health, if there's somebody COVID positive, health department is involved, and they have very capable, they have really great experts over there to help, and they have figured out through the last few months a lot of the resources. Earlier we were more involved to give them, here's who you call, and once they have the resources, they try to find the solution right there. Metro Social Services, there are different divisions that actually have case managers, and going back to an earlier question, they immediately engage people in housing, looking at IDs. When people don't have IDs, they work on birth certificate replacement, ID replacement, getting community assessments done, seeing what other barriers to housing need to be removed, and start the housing search. And that's what Metro Social Services does as they are operating the shelters. So that's already all in the going. Metro Social Services case managers work very closely with the health department. We are brought in complex situations where we then just to brainstorm, see where our connections are within the community, what we can think of, who we can pull in to solve individualized issues that are complex. Okay.
So you have got a lot of people coming in and out, particularly because of the pandemic. It's a little different, and we're going to get into the winter plan in just a minute. But you've got people within these facilities right now. You've got the Mission, you've got Room in the Inn, you've got Safe Haven, you've got Open Table Nashville doing their coordination. Services, you've got people, you've got 63 people in the facility at the fairgrounds right now, and then you've got another 73 that are waiting to determine the testing. How do you figure out what they need? You've got them right there. Are there folks from your office and from social services there that are going like individually, let's figure out services, all those other things, so that because they're right there. How do we do that?
Yes. So that is going back to the system I talked about, what we are doing as a community. That's going back. There is a community assessment to see how vulnerable are people and what do they need, and to kind of pinpoint where are what are the needs to make sure some paperwork is filled out. Are there some healthcare needs? But all of it, social services case managers are really trained to focus and hone in on what do we need to do to one by one remove a barrier to housing. And we are, as the community, as I said, we are right now having this opportunity with the rapid rehousing dollars to then identify, here is a landlord, here are the eligibility criteria for this landlord. Who do we have who's extremely vulnerable, who matches that eligibility? Can we actually make that match? And that's where also some of these, we're setting up the system, we're tightening it right now, where the coordinated entry process, when we talk about coordinated entry, it's also coordinated exit, where we're looking at how do we most efficiently then match a person with a unit as quickly as possible. We want to fill that unit for the landlord as quickly as possible, because landlords can afford to just sit on open units, and there are enough people that need those units. So it's about helping people access that housing and the housing supports that are out there.
Right. And so
services is trained to do that. That's what they're working with right now.
And are they doing it right there at the fairgrounds? I mean, are they dealing? Okay.
Yes.
Okay. All right. So let me ask you a couple of other questions, and then because this is really, really helpful, we may have to have you come back. But let me ask you a couple of quick questions, and then we're going to get into the winter plan, because that's obviously coming very soon. There were a lot of questions about homeless encampments. I got everything from Brookmead Park to the Encore condominiums downtown to Hapwood, which I'm not sure where that is, but I'm sure that you get lots of calls about this. How do we deal with that? And then are we working with folks? I know some people may not want to, come into a home, and I understand that. But how do we deal with overall encampments, and what's the best practice that's out there to try to provide help in those situations?
Yeah. So yes, homelessness through COVID has been more visible than ever. And one of the things I want to really mention, because we're getting a lot of complaints all over Davidson County, and well, actually some are complaints. They just want people gone. And so a lot of people and neighbors are, what can I do to help? Because, a lot, I would say majority is that, but some are really just make them gone. So the reality is, COVID, the libraries are closed where people usually would be during the day, a lot of people. Day centers are not functioning at the same levels that they usually do. They're open, they're serving people, but they're not having people indoors hanging out because it's not safe. Waiting rooms at providers, even at medical providers or hospitals, are not handled the same way. People are not just indoors seeing. So where are they? On the streets. Then early on in it's improving now, but it was hard for people to access medical services, outreach services, even meal services had just stopped from not just nonprofits, because nonprofits really turned it around quickly, but also from, there's a lot of faith-based community outreach that had to stop. And also I talked to a person who said, look, I'm struggling because my community was my church and they're not having in-person meetings. So that was my only family there, kind of where he felt home. He hasn't been able to access them for months. That's just the situation. So mental health issues have really surfaced, and then behavioral issues. And we've gotten way more reports of violence. So that's the reality out there. With encampments, what we need to do, and a lot of the people on here have heard me say that, and I will always say that Band-Aids just don't work anymore in homelessness. The Band-Aid doesn't stick anymore. You can try to slap it on as often as you want, it's not sticking. The only thing that will stick is really housing and long-term housing and the supports. We need to get federal dollars and increase Section 8, other housing supports. That is really what needs to happen. Also, I looked at the data. We really, as a community, very carefully looked at where have we invested in housing and for whom. It's veterans have a lot of resources, so we have invested rapid rehousing in the past for veterans, families, youth, because we were lucky to get a huge grant on that, and also some domestic violence, not for individuals. That is the big gap in our community. That's where you see street homelessness. And that's what we're trying to correct right now with these emergency solution grants, and really focus on where the gaps are and serving the people where they are into housing. Now, best practice is to have solid outreach efforts. We are, through these grants, coordinating outreach efforts increasingly. I know that there was one submission done, and one application done that really focuses on increasing downtown outreach. I've talked to several organizations, including the Downtown Partnership, nonprofits, and also Intern Chief Drake, who really, really wants to partner with what can police do not to arrest people for homelessness. They don't want to arrest people. It's like just for being poor and for being homeless. Homelessness is not a crime. Now, there also, if there are incidences for any of us, whether housed or not, that's another issue, So we are looking at these collaborations. We are looking at intensifying, especially during and also after COVID. A lot of people experiencing homelessness come through downtown one way or another. So we need a very, we're looking at what does it look like to have also visible outreach effort in the downtown area, so people see that outreach workers are in the downtown area engaging people. Outreach is the best when there's housing. And now we have, for the next 2 years, some opportunities to house people and work with people to get to housing. And just looking that there is mental health. Co-op is very, very critical and involved in that. Mental health services right on the streets, bringing the services to the people in the streets and while we engage, building the trust. That in itself also takes a lot of effort and time, because people have been falling through the gaps everywhere. Homelessness is a process. It's not immediate. It's a lot of systems fail. We also need to realize when we don't have strong healthcare, when we have criminal justice systems that feed people into and release people into homelessness, just by the nature, that's nationwide. That's not just one, targeting our community in our city. That's just all over. When we have these systems that fail people and not the strong safety net that we actually intend to have, it ends up, people lose their housing and end up homeless. And then we look at the homelessness system, which is completely underfunded when you think about to fix all of that, to get people back into housing, and their affordability is an issue nationwide. I think the latest I've seen, there were 2 counties nationwide that still had housing units that were affordable for people at the low income spectrum. So, yeah.
So obviously a need for resources. This is a problem in so many places. Yeah. Tell me what you can, and you may not know this, and I've been trying to find out at some point. This goes back, I think it goes back to the Briley administration, and now obviously when the Cooper administration, there was talk about building something downtown. It was going to be housing.
Yes.
With a room for maybe entities to do some wraparound services. Where is that? Can you tell me where that is at this point?
Yes, at this point, they're still moving forward with 82 units. It's in the design and stage design phase, 82 units for permanent supportive housing. That's the goal, to be built on 2nd Avenue and Gay Street. It's 2nd Avenue North and Gay Street. I can't remember the street address, but it's right there actually by the jail and by a fire station in the downtown area. And also the sheriff's office at that area actually has more of a behavioral health facility. So it's not it's not just, we're really looking at what does the permanent support look like. The key there is, again, the dollars for the right supports to bring in. Permanent supportive housing only works when we have the support services right on site for the people to remain in housing. And that then would open the doors to make it available for people that are really have critical housing barriers in the general market, that in scattered housing a landlord would not be comfortable, or there's some housing barriers that otherwise could not be accommodated. So that's the goal that's still being worked towards. The goal is to have it open and built and open 2022, in 2 years. So that's the latest information I have, yes.
Okay. All right. So let me ask you one other question, then I'm going to go back to the outreach efforts. I know the sheriff is working on this behavioral health center within the new facility. How well does social services, the homeless impact division, how well do you all coordinate with sheriff's office, I mean, let's just bring them all in. The police department, you've already mentioned the Chief Graves, the Attorney General, the District Attorney, the Public Defender, because one of the things we had heard at one point, I think it was from the sheriff, is about the number of people that just keep coming through the system.
Yeah.
And the idea is, first of all, that's not what we want. We want to get people the services. The idea of just if we're not catching people as they come through the system and helping them, then we're going to keep that circle going. And so I guess the question is, how well does your division work with some of these other groups in terms of trying to come up with some efforts to try to get people out of that system and get them the help that they need?
Yes. So I'm going to start with the Metro Health Department really has pulled together and is focusing on people with severe and persistent mental health. They pulled together the Sheriff's Office, Police Department, mental health providers, a wider group, and they call it the Community Mental Health Service Improvement Project. And they're revamping that. We are a part of that. And I was really, with the conversations, everybody agreed when I keep pointing out, when we look at the most vulnerable people with severe and persistent mental health issues, there's usually a housing crisis involved. So there is this overlap that you just described with the different systems: shelter system, healthcare system, justice system. So juvenile justice is, by the way, at the table too. So there is a multi-departmental effort going on to really focus on that and coordinate. And it's really the health department has a coordinator to focus on that, and we are a solid part in those. We are especially involved in the subgroup that also looks at housing with that. And then secondly, we have traditionally over the last few years really built a solid relationship with the other departments. When there is an issue, we call department meetings with decision makers from the departments around certain issues to discuss what the issues are, what can we do, how do we coordinate together. You're also familiar with the Hub Metro, the 311 number. Mm-hmm. Any complaints that are homelessness related, police departments, precincts reach out to our division to see if we can send somebody out first to make sure people are aware of what the nature of the complaint are about their particular location or about some of their behavior, and then see, are they engaged in the community already? Are they working with a nonprofit? Who is that? Are they working on housing? Can we link them with somebody in the community? What can we do to link people and engage people? Do they know where the shelters are? And frankly, most people do know about the resources and where the shelters are. And for whatever reason, they're just not there. And then outreach is best, as I said, and I can only repeat it when there is some housing available. And right. It's not one a cookie cutter approach, one approach fits all, and here's what you do for everybody. It's really individualized, and we just haven't traditionally had, we just don't have enough options. So one of the things, yes, I'm talking about this $10 million, but we also need to realize as a community that's one-time dollars. So whatever system we build right now, in my mind, I'm already shifting into, okay, what do I, in the position I'm in, have to do to bring the communication around sustainability? Who needs to talk to make sure that after those 2 years, what's the sustainability to continue resources and continue those? We also cannot afford to lose any of the existing dollars that from whatever source, local, federal, we can't afford to lose any of the grants dollars, anything that we're doing that moves people towards housing. The other thing I'm going to preach constantly is like, it has to be about housing. Homelessness is, in its definition, when you think about it, it's a housing status description. And so everything we do has to be about housing. But I also have to be clear, because sometimes people don't hear me say that. Housing alone is not always the solution. For a good portion of, let's say, families with children that they lost their job, the parents, they find themselves in a situation where they cannot maintain the housing. They are working on a job, they have a job again. Well, they may need fewer ongoing support services than a person who is 62 years old, has severe mental illness, has a physical disability, and is unable to get a job again. So those supports, that person probably needs ongoing supports, because even when we get them some Social Security income, it's not enough to just, there needs to be some other subsidy or they cannot be in housing. So that's kind of where we need to then figure out who receives what assistance where and for how long. That's what I mean. It's not housing, but both of them need housing, right. But the housing may look different. For one person, it may be a shared living situation. For one person, it may be, we just need our 2-bedroom, 3-bedroom apartment, and that's all we need, and some supports. That's just, but the support services and those conversations need to be part. And that's where that departmental coordination also comes in. Where are the resources that we can bring together? And what I've observed, all the departments are really open and willing to work very closely. Most of them work very closely with nonprofits, the nonprofit community.
Okay, so tell me, we've got about, we've got a little bit more than 5 minutes left.
Yeah.
Tell me, winter.
Yes.
Winter is coming.
Yes.
And so typically in the past, Room in the Inn, the Mission, a number of open table groups have stepped up, but this year, unlike anything we've ever seen, they're limited in capacity.
Yes.
They cannot fill the way they've done in the past. Typically in the past, people have gone out and done outreach and transported. I've done that. That's got to be limited because of the pandemic. So this is really unique. In how this is going to work. So what is the plan at this point for the winter?
Yes. So we also, at the winter approach, the cold weather approach, we had as a community in those groups, and thank you for always being part of that conversation, and talking to the outreach and the volunteers that do the canvassing. 20 degrees seems to be when people usually are ready and want to come in. So that's kind of the trigger. So this winter, we are actually, I've described that there are separate buildings at the fairgrounds. Well, there is one section that is currently used for some entertainment and food, cafeteria type, that can be and will be restructured to be actually separated from that well side where people are doing the social distancing shelter, and then also the sick side, let's call it the sick side, where it's people that are waiting tests and COVID. There's another section that will be set up for the winter shelter. Now, people can come in directly. There's going to be cold weather bus passes. There is a bus station close by. What I'm hearing, and actually we're going to have a meeting this week where I hope to have more information, that outreach will be more intense during the day. We will have flyers, so people and identifying people that need a little bit help to come up with their own plan and how they're going to get there, and then help with bus pass or whatever needs to be to get there and figure that out. And then the shelter will be open 28 degrees at 7 p.m. to 7 a.m. However, in the morning, when people, if they want to stay and say, hey, I don't want to go back out, there's going to be a process. There will be a protocol, COVID protocol, for their own safety and everybody else's safety at the shelter. One is, as people enter, of course, there's going to be temperature checks and the usual checks. But if they decide to stay, they will be able and have the opportunity to stay at the sick shelter, get a test, and they will get the information how to get the free test through Metro, and then just stay there until that test is negative, and then they can move over to the well shelter. And those are kind of, it's more complex with the shelter entry, but again, it's in the COVID situation. And so that's what we are looking at. And that's what it's built around, to really see. We always need to look at, so the winter shelter always starts November through March. I have asked how long the fairgrounds will be open. I'm just putting that question out there because everybody asks. And the response, it's really, right now, Metro doesn't have any plans to close it for right now. So it's really COVID driven and COVID decisions on that.
So we're going to have, so Room in the Inn, half capacity, Mission, probably half capacity. So the city basically is using the fairgrounds as a big catch-all to try to help in this situation. Because we're just about out of time. If people want to help, first of all, maybe two questions to end this. If they're more interested in finding out how this is all going to work, go to your website. Is that the best way to find all this information out? If they want to find out what the winter plan is, how do they find that out?
I will update this month. There is a website, Nashville, coldweathernashville.com, coldweathernashville.com. It's a privately donated site that is kind of our community site that we're doing. It's not updated yet. We usually by the middle of the month do that, so we have the most recent information for all the partners. Right now, we're finalizing from the partners. We have the plan for what Metro, how we are set up in the Metro as the city, but I don't have the details from every partner yet because it's so different, and they just need to see how many partner, what they feel comfortable with and their volunteers are willing to do. By the middle of the month, that website will be updated. Then also, I'm still encouraging people to just email me at judith.tackett@nashville.gov. If you have questions, send that to me. I would love to get you on also the newsletter. That's a monthly newsletter for our community that gives you a start, where to look. Websites are sometimes hard to maneuver because homelessness, everybody has a little piece of different information on the website. So feel free to just ask me directly. I'm here for that.
Okay. So I see Ms. Lingo has just posted it for everybody so that everybody can get access to the cold weather plan. And then you can obviously get in touch with Judith. Judith, this has been a wealth of information. My guess is we're going to get more questions about this. I know that there's a meeting this week. This is very important. One of the great things I'll say is that we've been working on this plan for the winter early on. Usually we were dealing with it in October and November. This group has been working on it since over the summer to make sure that it's correct, particularly during COVID. Lots of intermoving pieces. We may want you to come back at some point because this is of concern to lots of different people for various different reasons. But this year, unlike any others, has to be more focused because there's different aspects to it that have to be included, and because the partners also are limited. So a very interesting time for folks. Get in touch with Judith, get on the newsletter, get involved. That's really important. So Judith, can't thank you enough for taking time this morning to be on the program. And I will tell you that for those folks listening, Jennifer Gamble, who is a council member, who is the chair of our Public Safety Committee, will be our guest next week. Should be pretty interesting. Still a lot of things happening with public safety over the last year and this year. And I will tell you, for the first time since March, the Metro Council will actually be meeting together. The Music City Center has provided us at no charge space. And so there are tables set up. We will be in the Davidson Ballroom on Tuesday night at 6:30. And the council, again, for the first time since March, will actually be together. And so everybody's welcome to tune in, or the public can come. I was there yesterday, and it's all spaced out so people can practice social distancing. Judith, again, thank you. Have a good rest of the day. Everybody have a great weekend. Stay safe. Wear your mask. Practice social distancing. It's very, very important. Okay. Thanks again, and hopefully we'll see or talk to many of you next week, next Saturday. Thanks, everybody.
Thank you so much. Thanks everyone.